Hello everyone, I am Dr. Santosh Kumar, Orthopaedic and Joint Replacement Surgeon, predominantly working with hip and knee issues in the city of Kolkata, West Bengal. In our present series, we have been discussing various orthopedic issues so that you can get correct insight into the problem, you can go into the correct line of treatment, the correct direction of treatment, and you can avail the best possible treatment. And I can assure you right here in the city of Kolkata, I will make you available the best orthopedic treatment, the world's best and the finest in orthopedic surgery right here in the city of Kolkata. So in today's topic, we will be discussing about hip arthritis. So hip joint, as you know, is the biggest joint in our body. It's a ball and socket joint. There is a ball and there is a cup. So hip joint is the joint which connects our thigh bone to the pelvis bone. It's a joint which connects our thigh bone to the pelvis bone. It's a ball and socket joint. There is a ball and there is a cup. So this is the biggest joint and we walk on this joint. This is a joint means where two bones meet and the top is covered by cartilage. So this joint is very important for our daily activity, our walking, our running and everything. So this joint sometimes get affected by various problems. So those issues can be one is because of fracture and the non-fracture things. So today we will be discussing about the arthritis aspect, that is something that issues of hip joint which are not because of fracture. Before this, in various series we have seen how fracture affects hip joint, and subsequently we will also see how fracture affects hip joint, how we treat those hip joint fracture. But any affection of hip joint is something which is very significant, very serious, because it completely jeopardizes our movement, it causes immense pain, and that pain initially to start with is only while walking, but gradually the pain increases and increases, and it can stay even when a person is sitting or lying down at bed, or even when a person is trying to sleep. So we will be discussing about hip arthritis in this issue today. So as we saw that this is the hip joint. Hip joint is the biggest joint in our body. It's a ball and socket joint. It's a ball and cup joint. So there is the ball is formed by something called head of femur. The femur is the thigh bone and it articulates with the pelvis bone where the hip joint is formed. The ball is formed by this head of femur, and the cup is formed by something called acetabulum. It's the part of the pelvis bone. So in normal hip joint, this is covered by a healthy cartilage. What is this cartilage? This cartilage is the cushion which covers the joint. And in any kind of hip arthritis, this cartilage is destroyed. This cartilage is destroyed. The bones start rubbing with each other, and that causes immense and severe pain. That pain to start with is only while walking, which is manifest as painful limp. But later on, the pain also continues to stay whenever a person is resting also. So this destruction of cartilage and the destruction of the hip joint can be because of various kinds of arthritis. It can be primary osteoarthritis, which is rather age-related wear and tear, but this is rather rarer in India. Mostly we get in India, in our subcontinent, we mostly get secondary arthritis of hip joint. That secondary arthritis of hip joint can be because of ankylosing spondylitis, can be because of avascular necrosis, can be because of infective arthritis, tubercular arthritis, etc., etc. There are many other causes. We will be discussing in brief about this separately. The various arthritis types of arthritis which affect the hip joint, the most predominant among them is avascular necrosis. What avascular necrosis means? That the blood supply of the hip joint is jeopardized and that it goes into self-destruction and arthritis, and that is known as avascular necrosis. Sometimes in ankylosing spondylitis, the hip joint is gradually destroyed and fused. Now ankylosing spondylitis is a genetic disease of the our body which is related to HLA-B27. So all these things cause arthritis in hip joint. So whatever may be the cause of the source of arthritis, the end result is that the hip joint is destroyed, the cartilage is destroyed, and we need to do something for it, and that something is hip replacement in majority of the cases. Now the first investigation that we do an X-ray. We do an X-ray. That this side is a normal X-ray in which the ball is clearly seen in a circular shape and the cup is also seen in a hemispherical shape. So it is congruously sitting with there, and this is a normal hip joint, and this side we can clearly see that the space of the joint is destroyed there is whitening, which is known as sclerosis, the joint is destroyed, and the ball has moved upward and outward. This is known as subluxation. So these are the signs of arthritis that we see in X-ray. In X-ray, we normally see when the arthritis is quite advanced or moderately advanced. If we want to pick up in very early stages, we have to do MRI, wherein we can pick up the signal changes, and that is we can pick up in very early stages. But whatever may be the cause, the end result is arthritis, and it needs replacement. It needs replacement of the hip joint. So to see further how it looks in X-ray, this is the X-ray picture of arthritic hip. This is the X-ray picture of arthritic hip. We can clearly see that the congruous ball and socket is completely destroyed. This is whitened, and the hip joint is destroyed, and the femoral head is subluxated. So it's schematically, this is the hip joint which is involved, this is the ball, and this is the cartilage covering that ball is involved, and the cup is involved, and ball in cup joint, this joint is involved, and this has to be replaced. This has to be replaced. So this is what is hip replacement. This is what is hip replacement, wherein the ball and the cup is replaced. The ball and the cup is replaced. This is what is hip replacement. Now to reach this hip joint, to do the surgery, various approaches are there. Approach means from where the surgeon does the surgery. So there are various approaches to the hip joint. It is medial, anterior, anterolateral, direct lateral, posterior. So these are all approaches in which the surgeon approaches the hip joint and reaches the hip joint and changes the ball and the cup. So what we basically do in hip replacement, we change the ball and the cup in the ball and socket joint. So various approaches are there, but mostly it is either anterolateral or posterolateral. This is what we practice, and presently we are doing minimally invasive hip replacement, in which minimal cutting is done. This is how we approach in a minimally invasive hip replacement. This is mostly posterolateral approach, and this is minimally invasive approach in which we approach the hip joint. Now what we do in this hip joint, we change the ball and the cup to a new implant. Like this is the X-ray of a pelvis bone. On this side is the normal hip joint, which has got a congruous ball and a hemispherical cup, but in this side it is replaced. The cup is replaced by a implant cup, and the ball is replaced by the implant ball, and it has got something called stem, which goes inside the femur bone. This is something which goes inside the femur bone, and this has got neck. Now this cup, ball and the neck come in various sizes of 1 millimeter or 2 millimeter increments. So on table or based on the sizing or based on navigation system, we decide the sizes of these components, and everything is modular. Everything is modular, and it is custom fit. It is custom fit to give the maximum amount of movement, stability, and all the component placement, the inclination, etc. is decided by the precise instruments, the surgeon's experience, and of course navigation. So this is known as total hip replacement, wherein we replace the ball and the cup completely. There is another thing which had been done in past but not done much now, which is known as hip resurfacing, wherein the whole ball is not replaced, but only the surface of the hip is replaced. And the cup is replaced. So this is known as hip resurfacing, Birmingham hip or Birmingham hip replacement, hip resurfacing. This is metal on metal. So this was frequently used till recently, but presently we have left this hip resurfacing, and we have gone back to total hip replacement, because total hip replacement gives the most predictable and the most sustainable and reproducible results. So we do get a lot of patients with ankylosing spondylitis. The maximum patients that we get for hip replacement are the patients who have ankylosing spondylitis or avascular necrosis. In ankylosing spondylitis, the hip joint fuses. Like this is the hip joint, the ball and cup joint is there, and this ball and cup joint fuses. The movement completely ceases, and the person finds it very difficult to sit on chair itself. The person finds it very difficult to sit in chair itself. The movement ceases, and this is known as ankylosis. Means the hip joint is fused. The hip joint is fused, in particular deformity is created, bending is created, and then the person finds it very difficult to sit on chair and even lie down. In that case, again we replace it with a proper ball and cup mechanism. This is a proper ball and cup mechanism, which is known as total hip replacement. The cup is replaced by a implant cup, and the ball is replaced, and this is known as total hip replacement, and this total hip replacement restores painless movement at the hip joint. It restores movement of the hip joint and restores painlessness. Now, as we saw, these components are modular. They have to be put in a precise position. They have to be put in a proper inclination. The millimeter measurements are there. So those things we do it better with navigation system. We use computer assisted surgery navigation for better cup placement, for better sizing, for better judgment, and of course above all these things the surgical experience, the surgical expertise, which is above all these things. We have been using multiple designs for better results, and most of these hip replacement components can be classified into two types. Most of these hip replacement components can be classified into two types. One is cemented and another one is uncemented. What it means is that the components can be put with something called bone cement. Bone cement is a polymerization reaction of polymethyl methacrylate, wherein the components are put with bone cement, and in other cases the components are put press fit manner where bone ingrows into that. So that is known as uncemented or non-cemented components. Normally in people who have elderly people with softer bones, with weaker bones, we use cemented implants, and normally in younger patients with stronger bones we use uncemented implant. But the final decision whether to put cemented or uncemented implant is always done on the operation table itself, because there are several conditions in which plan changes. We can shift from cemented to uncemented. Especially we presently use lot of system wherein a lot of ways in which the cup is uncemented but the stem is cemented. This is known as hybrid construct. It is pretty well established. Now the cup is, as far as possible, cup is uncemented, but stem can be cemented or uncemented. That depends on the strength of the bone, the fitting of the implant. I mean everything, the things are decided on table, and it is decided by the surgical team which is doing the surgery. So this is an example. In X-ray we can see these are the components. The cup, which is fit with screws. These uncemented cups are fit with screws if needed, or it can be press fit also, and then this is also stem which is put press fit. Other side we can see that this is a cemented component in which bone cement has been used to fix the stem. So to summarize, this is the construct of the hip replacement implant. It has got a stem which is made up of titanium, and then it has got a head. This has got a head which is made up of cobalt chromium or ceramic. The reason why cobalt chromium is used is because cobalt chromium can be most highly polished, and ceramic can also be most highly polished, and this is known as the bearing surface. This is the bearing surface. On one side it is metal or ceramic, and other side it is ultra high molecular weight polyethylene, which is highly cross-linked ultra high molecular weight polyethylene, and then it is put in a titanium shell. So this is the basic construct of the hip replacement implant, and these things, as we saw, it can be put with cement or it can be press fit. Those which are put with cement are known as cemented implants, and those which are put press fit are known as uncemented implant. Uncemented implants are coated with calcium hydroxyapatite, and they are porous fit so that bone ingrows on that, and that's something which becomes permanent. So as we saw, we have two types of stem component fixation option. One is cemented, another one is uncemented. Cemented means whenever we feel that the bone is weaker, or there is implant is not getting press fit, then we opt for cemented fixation. And whenever we are able to make it a press fit component fixation in the hard and strong bone, we opt for uncemented fixation. The concept of uncemented fixation is that the implants are porous coated with calcium hydroxyapatite or other ways in which the bone ingrows. So once the bone ingrows, the fixation is for longer time, and the implant is expected to last longer. So the acetabular component is all porous coated, and then in between inside that we have polyethylene liner, ceramic heads are there, and this stem option is either proximally coated or it is fully coated. Both systems are used, and Presently we are using large head cups. Those large head cups give us better range of movement. So these are the cups and the ball heads that we use. This is the traditional used Birmingham hip replacement, in which this is hip resurfacing. So this gives a immensely big head, and then the cup is there. So this gives a much wider range of movement. But as the head size increases tremendously, it also, the wear out rate also increases. So we had issues with Birmingham hip replacement, and presently it is not used that much as it used to be. So presently we are using this total hip replacement components, which can be ceramic on ceramic, that is, the head is ceramic and the liner is also ceramic, and the cup is put, which is made up of titanium, and it is porous coated. And this is a cemented cup, in which the whole cup is made of ultra high molecular weight polyethylene. There is no metal in this, and this is put with bone cement. So this is something which was used traditionally, and still it is rampantly used. And here the stem is also cemented. This stem is put with something called bone cement. This is how it would look in X-ray, an uncemented implant. It is press fit, and this is how it would look in X-ray. So presently we are using larger head implants. We are using larger head implants so that the range of movement of the hip joint is increased. A person can do all sorts of movements, sit cross-legged, and their hip range of movement is increased with large head implants. And presently we are also using something called dual mobility, in which the range of movement further increases. Like this is a dual mobility cup, in which the acetabular shell is there, which is the cup which is put in the acetabulum, and the head itself consists of two parts. One is in which there is a ceramic head, another one is there is ultra high weight polyethylene. So this behaves like a bipolar head, and the whole construct behaves like a tripolar. So as we saw, we have two types of stem component fixation option. One is cemented, another one is uncemented. Cemented means whenever we feel that the bone is weaker, or there is implant is not getting press fit, then we opt for cemented fixation. And whenever we are able to make it a press fit component fixation in the hard and strong bone, we opt for uncemented fixation. The concept of uncemented fixation is that the implants are porous coated with calcium hydroxyapatite or other ways, in which the bone ingrows. So once the bone ingrows, the fixation is for longer time, and the implant is expected to last longer. So the acetabular component is all porous coated, and then in between, inside that we have polyethylene liner, ceramic heads are there, and this stem option is either proximally coated, or it is fully coated. Both systems are used, and presently we are using large head cups. Those large head cups give us better range of movement. So these are the cups and the ball heads that we use. This is the traditional used Birmingham hip replacement, in which this is hip resurfacing. So this gives a immensely big head, and then the cup is there. So this gives a much wider range of movement. But as the head size increases tremendously, it also, the wear out rate also increases. So we had issues with Birmingham hip replacement, and presently it is not used that much as it used to be. So presently we are using this total hip replacement components, which can be ceramic on ceramic, that is, the head is ceramic and the liner is also ceramic, and the cup is put, which is made up of titanium, and it is porous coated. And this is a cemented cup, in which the whole cup is made of ultra high molecular weight polyethylene. There is no metal in this, and this is put with bone cement. So this is something which was used traditionally, and still it is rampantly used. And here the stem is also cemented. This stem is put with something called bone cement. This is how it would look in X-ray, an uncemented implant. It is press fit, and this is how it would look in X-ray. So presently we are using larger head implants. We are using larger head implants so that the range of movement of the hip joint is increased. A person can do all sorts of movements, sit cross-legged, and their hip range of movement is increased with large head implants. And presently we are also using something called dual mobility, in which the range of movement further increases. Like this is a dual mobility cup, in which the acetabular shell is there, which is the cup which is put in the acetabulum, and the head itself consists of two parts. One is in which there is a ceramic head, another one is there is ultra high weight polyethylene. So this behaves like a bipolar head, and the whole construct behaves like a tripolar. So that because of this, the dual mobility hip, the head size is tremendously increased. It gives more range of movement, and of course the chances of dislocation are extremely minimized in this dual mobility hip. But that doesn't mean that dual mobility hip is superior than a well done large head hip. It's not like that, because dual mobility hip is more used for people who have muscle weakness. It is more used for wherein there is chance of dislocation. But dual mobility hip, the life may not be as long as a normal large head hip. So dual mobility hip, the other problem is that there is wear and tear at two surfaces, where it starts at this surface and where it starts at this surface also. So that is the problem with dual mobility hip, and it may not be as good as large head hip. So this is on one side is total hip replacement, other side is surface replacement, or this is known as BSR, Birmingham surface replacement hip. This is something which is done on both sides, Birmingham surface replacement. These are the presently used uncemented components. This stem is porous coated with calcium hydroxyapatite for bone to ingrow, and this acetabular cup is again coated with calcium hydroxyapatite, and then bone ingrows on that. So this is the bearing surface. Bearing surface, the head, it can be made either of cobalt chromium or it can be ceramic. So ceramic is something which can be most highly polished, and this is rampantly used. Ceramic on ceramic is being used, and this is something which offers extremely large lifespan of the hip. It is almost for 40-50 years. But presently we have shifted from ceramic on ceramic to ceramic on poly, because on one side we use ceramic and several times inside we use a poly liner. So that gives a better result several times. So once we have been doing the hip replacement has been there for last 50 years, for more than 50 years. So sometimes we are faced with consequences in which we have to do revision hip replacement. Means we have to do a hip replacement for the second time, wherein already implants are there, and then we have to do a hip replacement for the second time. For that we use special implants. We are routinely doing revision hip replacement. What it means is we are routinely doing redo of hip replacements. If a hip replacement has loosened because of after 40 years, 30 years, if there is any problem, it has to be redone, then we are routinely doing revision hip replacements, and revision hip replacements are equally successful. Revision hip replacements are as successful as primary hip replacements. We have special implants for revision hip replacements. So these are special cups and cages with multiple fixation options. These are the implants for revision hip replacements. The stem is very long stem are there, and multiple bone fixation options are there in revision hip replacement. Well, hip replacement is the most successful surgery in medical science today. It's a life-changing surgery. It's a surgery which gives complete pain relief overnight and makes an immobile patient run within few days. So this is the most successful surgery in medical science today. A well done hip replacement we have done for this patient. A well done hip replacement starts running and jogging by a couple of months. So this is a truly life-changing surgery, and better and better implants are there which can make the hip replacement last for more than 40 or 50 years. It's for lifetime. It's almost for lifetime. The person starts walking after both sides hip replacement. We normally do, if a person needs hip replacement on both sides, we can do one by one, or we can do both hips in single sitting. If we do both hip in single sitting also, the patient starts walking from the very next day of surgery. We mobilize the patient immediately, and within a month or so patient can join his office and restore his normal and routine activities. So in the present video we discussed about hip replacement, how successful it is, and how how life changing it is, a well done hip replacement. So if you have any queries, please WhatsApp me or mail me or write to me. My WhatsApp number is 9831911584. I repeat again, 9831911584. And please do come to Kolkata if you need any treatment for this hip problems. Over here in Kolkata, we will offer you the world's best and most advanced and at the most affordable rates. Thank you.